Dr. Naney, Craig asks, when do I need to use medication for my migraines?
Well, we talked last time about as-needed medicines for headaches, for migraine. Those are the medicines that people can take if and when they get a headache. But there are certain cases where we would use preventive medicines for the migraines. These are medicines that we will take on a daily basis to prevent the migraines from coming on. We may or may not be able to prevent all of them, but at least we'll lower the intensity of each migraine and also lower the severity of each migraine. And usually we use these medicines on patients who have about 2 or more headaches a week. There are a lot of exceptions, but that's a good rule of thumb. If you are getting more than 2 headaches a week, Greg, you can then be placed on preventive medicines for migraines. And those are the medicines that you'll take every day, in addition to an as-needed medicine that you can take when you get a headache. In addition to the frequency of the headaches as a reason to use preventive medications, sometimes if the migraine is extremely severe, that we cannot get rid of it with as-needed medicines, we may actually go in and use preventive medicines to help the severity of the migraine. For example, if the person is a higher-powered politician, although those are rare nowadays, one can use preventive medicines to lessen the severity of the attack if and when they get it. But generally speaking, we would use preventive medicines only if the frequency of the headaches is more than twice a week.
Okay. And what are some of these medications that you're calling preventive medications patients can use?
That's a very good question. There are many medicines out there. They are generally classified as antidepressant kinds of medicines. That's one classification. And the commonest ones used are in the family of what's called tricyclic antidepressants. The commonest two are nortriptyline or Pamelor, or amitriptyline, or Elavil is the brand name for that. And those are medicines that are usually used at night because they have sedating qualities to them. So patients tend to be a little tired and fatigued and sleepy with these medicines. Now, sometimes you can use this to our advantage, so we can give them to patients who have a lot of migraines who are not sleeping very well at night. Another class of preventive medicines are the beta blockers or the calcium channel blockers. And these are medicines that are sometimes used in patients who have high blood pressure or heart disorders, and we give them to patients who have migraines to take them to prevent the headaches from coming on. Another common class of medicines is the anti-seizure medicines or anti-epileptics, and those are commonly used also as a preventive agent for migraine. The commonest one we use nowadays is topiramate or Topamax, and that is used once a day or twice a day on a daily basis. It does not have severe sedating side effects, so we tend to use it in people who get a lot of headache and don't want to be tired during the daytime. It does have other side effects though. It can cause weight loss, sometimes wanted, sometimes it's unwanted. It increases your chance of having kidney stones and can lower the effectiveness of birth control pills. Also, if the person taking it is a female and the patient ends up pregnant, then there's a high risk of fetal defect to the baby, especially cleft palate. Other medicines that we can use is Depakote. We don't use that as much because it has liver toxicity and also can cause some skin and cosmetic side effects, but it is extremely effective for preventing migraine. And gabapentin or Neurontin, that's a commonly used agent also. There are other ones, but they are somewhat less effective. The American Academy of Neurology recently, I think in the last couple of months, had a publication as to the practice parameters for use of preventive medications for migraines, and the lamotrigine or Lamictal, which is an anti-seizure medicine, was not found to be extremely effective. I was actually surprised at that. We had used it in the past. It was thought by many not to be as effective as it was thought of before.
Okay. And what about patients if they have questions about using anti-depressive medications for this? What would you tell them? Why is it a good choice?
That's a good question. They often call us or email us right after they receive the prescription saying, well, doc, I'm not depressed, why am I getting this medicine? And it behooves the doctor who's prescribing this medicine to tell the patients that it's actually not used for depression. It's in the class of antidepressants, but not used for depression in this particular case. They are just effective. It does have a side effect of elevating your mood a little bit, so it may help the person who's getting a lot of headaches, who's somewhat sad, and can help make them happier some degree.
And are there any over-the-counter medications we can use as preventative?
Excellent question, Dana. No. It is a common mistake that people take over-the-counter medicines frequently and almost on a daily or near daily basis to prevent migraines. But these medicines are thought to cause what's called CDH, or chronic daily headaches. Sometimes they're referred to as rebound headaches. And these are headaches from the medicine. These are headaches from taking this over-the-counter anti-inflammatory medicine. The commonest one that we see is Excedrin. The fix for this rebound headache is to place them on a prescription level, if you like, preventive medicine, and withdraw the over-the-counter medicine. Over-the-counter medicines, as we spoke in an earlier video, can be used as first-line treatment for as-needed treatment, or so-called abortive or acute treatment, but not to be used on a daily basis. Now, there are other modalities besides the medicines that we talked about that we get asked all the time, which is Botox injections, for example. Botox injections are approved now for preventing migraines. There are certain criteria we have to meet for the insurance provider to allow us to use that procedure. It's a simple procedure. We'll have a special video on it down the line, but it's a procedure where we inject the forehead muscles and certain sections in the scalp every 3 months to prevent headaches, and it's quite an effective procedure, and patients are quite satisfied with this. So perhaps if we get asked about that in the future, we can talk about that.
That sounds great.
Well, see you soon then. Thank you.
All right, thank you.